Well, thank you for having us tonight. My name is Dr. Vicki Gordon. I'm from St. John Providence Health System. And we were asked to present the telemedicine program that we have here at McKenzie Hospital in Sandusky. We've been working with Dr. Hammond and the administration here at McKenzie for about the last 4.5 years. The reason for all of this is many rural areas have a very high rate of disability and death following stroke, and one of the reasons for that is lack of access to neurologists and neurosurgeons who specialize in stroke treatment. So we worked with a technology company to really develop a device that would allow us to bring specialists to rural facilities, and this is one of the devices that we have here at McKenzie. And Dr. Hammond is probably the one here at McKenzie that has had the most work with this device.
Having that specialist on consult with us in the room essentially is a very huge benefit for the patient. It's led to some really good outcomes.
So what we're going to be doing tonight is we're going to kind of run through how it is we activate the network, what it is the neurologist will come on to the telemedicine device and actually walk us through a stroke, and it's a pretend stroke, obviously.
According to the EMS, you asked him when it started, and he said about half an hour ago. So do we have a time from about 12 o'clock, 12:15ish or so when all this kind of might have happened?
That sounds about right, yes.
It's about 12:45 right now. Okay, so roughly about 45 minutes to an hour ago.
Yep.
Most, okay. Hey, Dr. Silverman, how are you doing?
Hi, Dr. Hammond, how are you?
I'm doing okay. I have a patient here, Steve, with the last known normal time at about 11:45, 12 o'clock. He was found by his sister to be somewhat unresponsive to commands, some right side weakness, deficits. Brought in here, he had the CT, and it does show, looks like a left-sided infarct. On examination so far, it looks like he has signs pointing towards complete right side weakness of the upper lower extremity, as well as the facial muscles as well. He has some difficulty with the gaze to the right. Sensation on the right side is not intact.
A couple questions for you, Dr. Hammond.
Sure.
What is the age of the patient?
Steve is 51 years old.
And do we know if he's right or left-handed?
He's right-handed.
And we have a well-documented time of onset of symptoms at 11:45 this morning.
Correct.
That was his last known to be normal time?
Correct, yeah, that's about an hour ago, correct.
And as far as his labs are concerned, you had mentioned they were okay. Can you give me his blood sugar?
His blood sugar was 112.
And what about his PT, INR, and PTT?
His INR was 0.96. PT and PTT were both right as normal limits on our system.
Did he give you the size of the infarct? It was a small infarct, it was a large infarct? Did they describe whether it was greater than a third the size of the middle cerebral artery distribution or not?
They said it was a small infarct, with no mention of the...
Small infarct, great. And no evidence of hemorrhage on the CAT scan?
Correct.
Okay, great. Good job. Thanks for sharing all that information with me. Do you mind if I interact with the patient for a moment?
Good.
Thank you. Steve, I'm going to adjust my robot here a minute. Can you hear me okay, sir?
Yeah.
I would like to ask you a couple quick questions, if you don't mind, just to confirm some of the information. You're 51 years old?
Yes.
And by the way, Steve, my name is Dr. Silverman. I'm a neurologist. I work within the St. John Providence Ascension Healthcare team, and we assist the doctors at McKenzie Hospital in management of patients. Let me ask you a couple questions. So you're 51 and you are right-handed?
Yes.
Is that correct?
Yes.
When these symptoms came on, do you recall what you were doing?
No.
Okay. But you do believe the symptoms came on in about 11:45, and that was your last known to be normal time?
Yes.
Okay. Steve, other than high blood pressure, any other major medical issues?
No.
I'm going to ask you to do a few things for me if you don't mind. By the way, you don't have a headache now?
No.
And when the symptoms came on, you did not fall and hit your head or anything like that?
No.
Steve, can you tell me what month it is right now?
No.
Can you tell me what year it is?
2014.
Good. Steve, would you do me a favor and smile real big for me? Good. And I want you to raise your eyebrows up. Great. And I want you to close your eyes real tight. Good. And then if you don't mind, I want you to open your eyes up really big. And I want you to look over to the right. Open your eyes really big. That's good. Now I want you to look all the way over to the left. Good. Okay. Steve, I'm going to ask you to look straight ahead at me, and I'm going to ask Dr. Hammond to wiggle his fingers to the right, and then I'm going to ask him to wiggle his fingers to the left, and I want you to tell me if you see his fingers wiggling.
Yes.
Okay, how about on the other side?
Yes.
Good. With your right hand, can you touch your nose? Okay. Not so easy, eh? Okay. What I would also like you to do, I'm going to ask Dr. Hammond to touch your right arm, and then your left arm, and then both arms, and I want you to tell me if they feel about the same. You feel that?
No.
How about on the other side?
Yes.
As he touches both sides, do they feel equal or do they feel different?
Different.
Which one feels more?
Left.
Okay, and then this last slide, can you read this?
2. From table, room.
Great. Okay. Dr. Hammond, I wonder if I could speak with you for just a moment.
Sure.
And Steve, I'd like you to hear this as well. Today it appears as though you have sustained a stroke, and the stroke most likely has affected the left side of your brain. Dr. Hammond, I have a National Institute stroke scale of about 17, and our last known to be normal time as 11:45. What time do you have now?
12:52.
So clearly, given the new criteria, our stroke criteria for inclusion criteria for TPA would be within this 4.5-hour window. He seems to meet that criteria from what I'm hearing here. Steve, what we'd like to do is give you medication to try to reverse the symptoms related to this stroke. The medicine that we use is a very potent blood thinner, and I think it could be of value to help reverse some of the clinical symptoms there. Dr. Hammond, I would like to know if that would be appropriate based on your clinical setting there as well.
I believe it would be, correct.
Yeah, so I think that we should proceed with TPA administration to help reverse these symptoms. Because we work within a healthcare system, we're able to provide some advanced care as well. My recommendation would be that we provide the TPA local at the McKenzie site so that we can begin the process of improving blood flow to the brain and then begin a transfer to our local hub hospital. Can I help you with that, Dr. Hammond?
Yes, please. Thank you.
Okay, so if you could handle any further issues regarding the TPA administration and perhaps any blood pressure issues that may come up, I'll contact the endovascular team and the transport team to help facilitate the care of the patient.
Very good. Thanks again. I appreciate it.
My pleasure. Thank you so much. And Steve, I wish you the best of luck in the recovery from this stroke. I will have the neuroendovascular folks be calling you very soon, and as well, we'll get the transport team in place.
Thank you.
Good speaking with you. Bye-bye now.
No.
Yeah.
I'm back.
No.
My God, that TPA works fantastic. I think he looks a little younger, if you ask me.
I think you're right. I love the resolution on the camera.
This man has the resiliency of a rubber ball. I've seen him stroke out on multiple occasions, and the next thing I knew, he's up and walking. There's something about the care that is provided at McKenzie Hospital that's second to none. I will share that.
There you go.
You know, the fact of the matter is the beauty of this process is that you have to think on your feet. You have to be able to adjust accordingly. And sometimes the history, when I get the history from you, as you well know, Dr. M, is different when the patient gives us the second history. And that's why we're a team. We collaborate so much, Steve, when it comes to the management of these people. Like, my eyes and ears are the people on the ground there. And I have to say that the folks that I've dealt with at McKenzie, you know, they're very committed to this process, and it's really a pleasure. It's a pleasure to work with the entire staff there. For me, at least, I've had nothing but positive experience, and hopefully this has proven to be a value to the system within the Thumb network that you guys work at, as well as at McKenzie.
Yes, it has. Thank you.
Do you folks have any
Great,
questions?
great. Well, we'll keep in touch, and if there's anything more I can do, please let me know.
Thank you.
Thanks.
Thank you.
Have a great evening.
You too.
You too.
Have a nice holiday.
You too.
Yes.
Yes.